Okay, next we move on to therapy, chapter 15. The Freudian approach. The Freudian approach is the techniques of psychoanalysis that we talked about, the free association and so forth, and the dream analysis. The idea is you get transference, that you start transferring the feelings you have. The idea of the Freudian psychologist is to tap into the unconscious mind, get some transference so you can learn how to get through some of these things that go on in your mind and hopefully heal from them. So we don't use a lot of psychoanalysis and modern day therapy. More often we use things that are humanistic. Humanistic is kind of client-centered therapy. We try to, once again, boost people up in terms of self-awareness and acceptance. You try to be active in listening and showing empathy and trying to help people out. Page 549 of your book, you can add a few elements of that. Unconditional positive regard, we try to accept people. 550, we try to paraphrase. We invite clarification so we can understand what they're going through. So humanistic is a good way of doing things. Behavioral therapy, many times we try to do counter conditioning. If somebody has a phobia, let's say you have a phobia of the dentist. You had a bad experience, we try to have you go in and have a positive experience. You can counter condition the fear that goes on. Exposure therapy, if you're scared of water as a little baby, what do we try to do? Throw you into a pool, so you have exposure therapy. Systematic desensitization, if somebody has a phobia, you slowly show them a picture, then maybe you take them, if they're scared of a spider, you show them a picture of it and try to get them to relax and not have anxiety to it. Then you might take them eventually to a zoo, let them see it, let them touch, and slowly exposure to do that. Progressive muscle relaxation is another way to imagine the thing that causes anxiety and counter condition that to where they don't feel that anymore and they feel relaxation. So aversive therapy, if somebody is an alcoholic, many times you give them, do they have that actually in there? Looks like they have a figure in 553. You can give them a product that if they actually drink the product, they'll actually get very ill if they drink alcohol after that. I think it's called Actually, I have to look it up and put it on your outline there. So that's a way of doing aversive therapy. In operant conditioning techniques, you try to do positive and negative reinforcement to change what they actually do. If we go into the cognitive approach, you try to change how people think, their beliefs. Let's say that somebody got an F on a test. They might have the belief that if they got an F on a test, it's going to be that way, it's going to be global, stable, and it'll never change. You try to change how they think about it. Now, changing how somebody thinks and what they do can be very difficult things sometimes. So a behavior therapist, cognitive therapist, you can actually combine those approaches many times. So add some information from your book on these approaches. Finally, group and family therapy. Group therapy, even online group therapy, seems to be a good place to let things go and share things, and can be good for developing skills and coping techniques. Family therapy is a lot more work. Many times family therapy obviously involves the whole family. Not all players want to play very nicely in the sandbox, and pathologies develop over many years. It takes a lot of hard work to make family therapy really be effective, but if the family is committed and the therapist really knows what they're doing, that can make all the difference in the world. And finally, I'd like to talk a little bit about the biological approach. And once again, if you take physiological psychology in the fall, I'll go more into this. You can give people, if they have an anxiety, actually first we can start with the idea of schizophrenia. Many times we can give people medication that will simply block dopamine, and that'll help out schizophrenia. That can be very useful in certain situations. For anxiety disorders, we tend to give products that increase GABA, products like Xanax or Valium or Ativan. They actually work on increasing levels of GABA in your brain, and they can be very useful for anxiety. And then the antidepressant drugs. The first really group of drugs that was seen as being useful is depression was linked to low levels of serotonin. And so the idea was, let's increase serotonin. So Prozac, Zoloft, and Paxil, they block the reuptake, if you look on 569, of serotonin. So they keep the serotonin in there more. They're serotonin agonists, and they can help out with depression. And now they've even come up with new antidepressant products. I'm trying to remember some of the names of these things. Effexor might be one, and others that actually, besides increasing serotonin levels, they even increase norepinephrine levels. Effexor, I think Celexa might be another one that actually combine dopamine, actually norepinephrine, and serotonin increases. Other therapies as well, like electroconvulsive shock therapy, that can be useful as well for treating disorders. Finally, last but not least, what I wanted to share with you here is, for the last part of this assignment, I have a case that I'd like you to read through. I think it's a pretty straightforward case here of a college graduate finding life to be very difficult. See if you can use the information I've shared with you here and describe what diagnosis you would make in this situation with a rationale of why you would make that diagnosis. Then describe in a paragraph or two for each one 3 different therapeutic approaches that you would take, non-pharmaceutical, based on the acoustic lecture and the textbook information if you were the therapist. And then finally, medication management. What kind of medication would you prescribe at the simplest level if this were the disorder you say it is? And if that didn't work, what you would move up to, and kind of describe some of the pharmacology behind that. So hopefully this makes good sense to you. And you do this, you have a couple weeks to do this, send me drafts. I'll be happy to look it over for you. And that'll about do it. Have a great day and take care. Bye-bye.